working.
Well, good morning. Good to see you, Michael Dowling, who is the president and CEO of Northwell Health, which is the largest health system in the state of New York. It's very good to be with you. Dr. Chester, pleasure.
Good morning.
And to you, the person who's going to take the first vaccine in the state of New York, maybe the first vaccine shot in the United States, Sandra Lindsay, an ICU nurse. It's a pleasure to be with you. And you are in Long Island Jewish Medical Center, which is in the borough of Queens. Good things come from Queens. Let me start by saying thank you. Thank you, doctor. Thank you, nurse. Thank you, Mr. Dowling. Thank you for everything you've done for all New Yorkers.
She has seen a lot, and she's very, very happy to be here to receive the vaccine. And Dr. Chester is the director of our employee health services. So with that, Dr. Chester, we'll turn it over to you.
Thank you. How are you feeling today? I'm feeling great. Okay, so we're going to the left deltoid. How are you feeling today?
I am feeling great.
Great. Okay, so we're going into the left deltoid.
I'm ready.
Let's do this. How are you feeling?
I feel great. You have a gentle touch.
Thank you.
So, Sandra, you didn't flinch. I take it that Dr. Chester has a good touch.
She has a good touch, and it didn't feel any different from taking any other vaccine.
Great. Dr. Chester, it all worked, the kid from your end,
Everything worked perfectly. Thank you.
and you're feeling well?
Governor Coleman, I'm feeling well. I would like to thank all the frontline workers, all my colleagues who've been doing a yeoman's job to fight this pandemic all over the world. I am hopeful, I feel hopeful today, relieved. I feel like healing is coming. I hope this marks the beginning to the end of a very painful time in our history. I want to instill public confidence that the vaccine is safe. We're in a pandemic, and so we all need to do our parts to put an end to the pandemic and to not give up so soon. There's light at the end of the tunnel, but we still need to continue to wear our masks, to social distance. I believe in science. As a nurse, my practice is guided by science, and so I trust science. What I don't trust is that if I contract COVID, I don't know how it will impact me or those who I come in contact with. So I encourage everyone to take the vaccine.
Sandra, you didn't flinch. I take it that Dr. Chester has a good touch.
She has a good touch, and
I would like to see the overwhelming majority of the country vaccinated before we get to the end of the second quarter. Because I would like to see children, adults, everyone, so that when we get into the fall season, the children could feel really safe at going back to school. The teachers can feel safe that they're not going to get infected. We can get back to the economy being robust. Restaurants can open to full capacity. That's what I'd like to see. But you're not going to see it, Mark, unless the overwhelming majority of people get vaccinated. So in that sense, I would like to see the reluctant people get vaccinated sooner rather than later. If they want to wait a month or so, that's okay. That might be in accordance with the pace of being able to implement. But I don't want them to wait 6 to 8 to 9 months. I think they should do it within that period of the first 2 quarters of 2021.
Got it. And what do you think is the best argument to convince those people that taking the vaccine during that time frame is the right decision for their and their family's health?
Well, because as long as you're susceptible, you're part of the problem, not part of the solution. When you're protected, you're another person the virus can't impact. Whereas if you're vulnerable, even if you don't get a lot of symptoms, the fact that you've been infected means you are inadvertently propagating the outbreak. So if you want to be part of the solution, get vaccinated and say, I'm not going to be one of the people that's going to be a stepping stone for the virus to go to somebody else. I'm going to be a dead end to the virus.
This is a fundamental question about science these days. And I'm curious if there's any kind of wisdom that you would want to share with people about kind of the perspective on risk benefit in thinking through this.
Well, you're onto something there, Mark, and that's something we deal with in medicine all the time. Because when you're dealing with either the treatment or the prevention of disease, that you're going to do interventions, and there are no interventions of anything that don't have some risk. It might be a minuscule risk, but it's nothing. It's nothing that is completely free of risk. You take an aspirin, there is a risk for some people for an aspirin. So the way we deal with it, we deal with what's called relative risk and risk-benefit relationship. So if you look at the risk, the relative risk of an adverse event with a vaccine, and look at the history of vaccinology, it is one of the safest interventions that you can do. If you look at the benefit is to you as an individual and to society, particularly in the context of this terrible challenge we're being faced with this horrible pandemic that this world, this planet is living through, that an intervention like a vaccine that historically has very, very little risk, the risk-benefit ratio overwhelmingly.
Concern is whether people will be willing to take a new and unproven shot. Former Presidents Barack Obama, George W. Bush, and Bill Clinton have all agreed to get the vaccine, and they'll do it on camera. All three men have confirmed they would be willing to get an approved vaccine publicly to help promote its safety and encourage others to do the same.
This is a call for an uprising. Welcome to today's show. I'm sure you're just as thrilled as I am. What wonderful news. Our former presidents have volunteered out of the goodness of their heart, out of the care that they have for this country, the love that they have, which we saw with George W. Bush on that fateful day in September back in 2001, Barry Obama, and of course, the always dignified Bill Clinton, who has nothing at all in his track record that would make anybody skeptical of his presidency. These three fine presidents have decided to get together out of the goodness of their hearts to show America how safe this vax is. Isn't that wonderful news? Now, that's not using influence
right here,
or persuasion.
Bill promises that he will, quote, visibly take the vaccine when it's his turn.
President-elect Biden joined with former Presidents Obama and Bush and Clinton, suggesting that they would all take the vaccine publicly. Are you considering doing the same?
No, I'll do the same. When it's my turn, I'm not going to budge. But when my turn comes up, I will visibly take the vaccine. Because I think that it's a benefit to all people to not be transmitting. And so I'm super happy with all of these vaccines.
Influenza is serious business. During major flu epidemics, millions of people are sick and thousands die. Well, this year you can get protection. The vaccines are safe.
It will save millions of lives and soon end the pandemic once and for all.
The vaccines are safe.
This vaccine is safe for them to take.
We have delivered a safe and effective vaccine in just 9 months.
The vaccines are safe.
Here's why I feel it's safe.
These vaccines are also very safe.
There's an effort underway to educate people about how safe these vaccines are.
The vaccines are safe, easy to take, and they can protect you against flu. So roll up your sleeve. Protect yourself.
One of those who did roll up her sleeve was Judy Roberts. She was perfectly healthy, an active woman, when in November of 1976, she took her shot. 2 weeks later, she says, she began to feel a numbness starting up her legs.
I joked about it at that time. I said I'll be numb to the knees by Friday if this keeps up. By the following week, I was totally paralyzed.
So completely paralyzed, in fact, that they had to operate on her to enable her to breathe. And for 6 months, Judy Roberts was a quadriplegic. The diagnosis? A neurological disorder called Guillain-Barré syndrome, GBS for short.
These vaccines were created and tested in record time, under a year. According to the
Here, Bill's going to tell you that the only way out of this thing is to follow the rules.
Follow the rules.
His rules.
We're seeing record high cases, deaths, and hospitalizations in the U.S. right now, and those numbers are climbing. How bad do you expect things to get over the next 3 or 4 months before the vaccine is widely available?
Well, sadly, the next 4 to 6 months could be the worst of the epidemic. The IHME forecast shows over 200,000 additional deaths. If we would follow the rules in terms of wearing masks and not mixing, we could avoid a large percentage of those deaths. So in the near term, it's bad news.
Right here, Poppy Harlow and this dude named Melinda Gates or something like that are going to try to convince viewers that any information that runs contrary to their information is misinformation, and that their Silicon Valley oligarch buddies at big tech need to take care of dissenting voices.
Disinformation has been rampant, to say the least, throughout this pandemic. And it's rampant, once again, when it comes to the vaccine.
You're dang right misinformation is rampant. Most of it, of course, is coming from fake stream media.
What are the consequences of that?
Death. Disinformation can equal death.
Now, I agree with this. Disinformation does equal death. Think about the WMD lie or the Gulf of Tonkin lie propagated by fake stream media. Yes, indeed, disinformation does equal death, Melinda.
So if you don't do the right things to keep yourself safe, you or a loved one may die.
If you don't do the right things.
Translation, if you don't do what Bill, Melinda, Anthony, and CNN say, you may die. That's the corporate media message. The question is, do you believe it?
And that's why it's so discouraging to see so much disinformation spread out there. I think some of it is because there is a lot of anxiety. People are home more. They are looking at the internet more. We know if they go look at one piece of disinformation in a totally different category, then they're served up disinformation, for instance, in health or in vaccines.
Oh, you mean vax misinformation like this?
Judy, why did you take the flu shot?
I'd never taken any other flu shots, but I felt like this was going to be a major epidemic. And the only way to prevent a major epidemic of a really deadly variety of flu was for everybody to be immunized.
But one thing I do think will happen is as people start to see others taking the vaccine, healthcare workers, the elderly, teachers, people starting to be able to return to school and to normal life, I think they'll start to realize it is actually safe and I do want to take it.
It is actually safe and I do want to take it.
And what I tell everybody is ask your doctor. He or she knows what's best for you or your family. That's where you go for credible information, not the internet.
But unfortunately, a lot of people go to the internet, and you are formerly of the tech world. So I wonder if you could just speak to those in power at the tech companies, at the social media companies in particular right now. Do the social media companies, Facebook, YouTube, Twitter, on and on, have a responsibility to do more right now, Melinda, in terms of getting this misinformation, this disinformation off their platforms?
They absolutely have a responsibility. Anybody who's spreading information in society has a responsibility to spread that information safely and equitably.
They absolutely have a responsibility.
Translation, the big tech companies have a responsibility to protect you and me with fresh rounds of censorship.
We know there could have been less deaths. If we had started from the beginning, or reassessed on July 1st, or reassessed on September 1st.
Right here, Gates strongly implies that she would have called for a national testing and contact tracing, which is Constitution trampling plan, and a national mask mandate.
Instead of having 50 different state solutions, had a national plan for testing that was grouped up the testing so everybody had access to a lab and could get their results quickly, and then we did contact tracing, we would have kept the death rate down. We also should be telling people to wear masks. I mean, it's a practical solution. It's not comfortable, but it's not very hard to do either. We know masks make a difference. We know hand washing and social distancing. So we needed to be giving the right information and role modeling that for people instead of the opposite.
Now back to Fauci. He says that if we don't follow his rules and get the VAXX, this pandemic could go on into 2022.
Can you ballpark for us, if everyone follows these rules, what's the earliest it could end combined with the vaccine? And if people really don't, you mentioned fatigue or outright defiance, how long could this go?
Well, the last thing that you said, Ari, is the thing that is troubling to me, is that we have in our power and in our capabilities to do what it takes to end it from a public health standpoint until we get the vaccines in full effect, or we can go the other direction. We can say, you know, we're tired of this. We don't want to have any more to do with it, and it's going to get worse and worse. And we can say, I'm not particularly interested in getting vaccinated. So you could have the most efficacious vaccine in the world, and we're pretty close to that. 95% is pretty good. That's almost as good as the gold standard, which is measles, which is 98%. If we have a very efficacious vaccine, but only a relatively small proportion of the population gets vaccinated, this pandemic could go on well into next year, 2022.
This pandemic could go on well into next year, 2022.
If we don't do
22.
that.
Well, doctors, like they say, seatbelts don't work as well if you don't put them on.
Well, that's exactly right. And what I'm saying,
you know, for some jobs, like working in a nursing home, the government could decide that it's important for those people to be vaccinated.
The government could decide that it's important for those people to be vaccinated.
Whoa. I just got invited to give the commencement address at Harvard this year.
That's amazing.
I remember you did it 10 years ago when Priscilla graduated. I was there.
Yeah, it was a lot of fun. 30 years later than I was supposed to, but I enjoyed it.
They know we didn't actually graduate, right?
Oh, that is the best part. They actually give you a degree.
You don't even have to go to class?
No, you just put that degree on your resume and it looks great.
Can you help me figure out what I'm going to say?
Yeah, we should work on it together. Let's go get some more snacks.
All right. So you get to wear the hat and everything?
Yeah, you bet.